COVID-19 continues its spread, Americans are scrambling for ways to protect themselves against the virus. In the latest move, a recommendation for all to begin wearing masks in public is under active consideration. It's an issue addressed at Tuesday's coronavirus briefing.
It's just being considered by the task force now about whether that recommendation that already exists relevant to wearing masks should be altered in any way. So it's still under discussion.
You can get a mask, but you can also most people have scarves, and scarves are very good, and they can use a scarf.
Due to the great need for masks, the World Health Organization and CDC had previously maintained that only healthcare workers, caregivers, and people showing coronavirus symptoms should wear the protection. The head of the Chinese Center for Disease Control and Prevention has long urged overall use, telling Science magazine, "The big mistake in the U.S. and Europe, in my opinion, is that people aren't wearing masks. Many people have asymptomatic or pre-symptomatic infections. If they are wearing face masks, it can prevent droplets that carry the virus from escaping and infecting others." During an appearance on the 700 Club, neurologist and immune system expert Dr. David Perlmutter agreed about the value in wearing a mask.
One thing a mask will do is keep you from touching your face. When your hands are contaminated, which when you're out in public is likely to happen.
Others highlight the success of slowing the epidemic in places like South Korea and Hong Kong, where the majority wear masks.
So I've analyzed 38 scientific papers that have looked at the relationship between using masks and the transmission of COVID-19 and similar kinds of viruses. And they all tell the same story, which is that wearing a mask can decrease transmission by up to 50%.
Given the concern over the short supply of masks in the U.S., Joann Fabrics, the arts and crafts chain, is urging Americans to fill the gap and helping them do it. According to the company, all 860 stores are donating kits for volunteers to create cloth masks for hospitals and healthcare workers, complete with a how-to video. Cedarville University sophomore Connor Hart also found a way to pitch in.
Just seeing the pandemic affect so many lives and put so many people in need just really hurt me and made me want to find a way to help. We learned that we could start 3D printing masks to help with the shortages of masks facing many local medical agencies.
He's now using the printer to make plastic reusable masks round the clock, shipping them to medical facilities in need. Connor says with his school closed, it's the least he could do with his free time.
I'd rather be out helping people during this time than just trapped in my basement or in my room doing just video games or something.
Charlene Aaron, CBN News.